I think we might have another couple of people join in the next few minutes, but we can at least kind of get started. So thank you all for joining us. Just a reminder, anyone who has joined since I last said this, if we are recording the session, so if you don't want your voice or face on the recording, please turn off your camera and mute your microphone. And please mute your microphone anyway, just so we can avoid any background noise. We are going to be talking during the session about various kind of health goals that people might have throughout the year and how we can make them more actionable, more sustainable. And then we'll kind of be workshopping that at the end. So if you have some ideas about what your goals might be, you can start kind of thinking about that or writing it down. And then we'll have a portion at the end where we'll have a chance to kind of do some Q&A or talk about it and workshop that a little bit. So without any further ado, we'll get started. Thank you all for joining us. I'm Rebecca Berens. I'm the family physician and founder of Vita Family Medicine. And this is Abbie Madden, my co-host. So I will go ahead and Abbie, you can go ahead and introduce yourself.
Okay, hi everyone. My name is Abbie Madden. I'm a registered dietitian and owner of Space City Nutrition, which is a group practice of dietitians here in Houston. We have 3 people on our team, including me, and we specialize in eating disorders primarily, but also see people with things like type 2 diabetes, PCOS, prediabetes, and just kind of generally trying to improve your relationship with food. I've lived in the Houston area for about 6 years now, and I have a dog who comes in and out of this office. So if you see the door opening, it's not a ghost, it's just my dog. The door doesn't actually close, so it's a problem I need to fix. But so yeah, I think that's about it.
Well, thanks so much for doing this with me. And as I said, I'm Rebecca Berens. I'm a family physician. I'm the founder of Vita Family Medicine. And we are a membership primary care practice in the Sugar Land area and serving all of Houston and actually Texas. I have some patients that live in Dallas and Austin and just see me once a year in person for physicals. And really our goal at Vita Family Medicine is making your healthcare more accessible and personalized, and also making the recommendations that we make for you very personalized and sustainable, and things that are actually going to fit into your life. And so that's why, I wanted to partner with Abbie to do this talk today, because I think Abbie is one of my favorite dietitians. We work together a lot on with several of our patients. And one of the things that I think is really important is having a care team that's really understanding of making things fit into your life and what's actually going to be possible for you and sustainable, and not something that's going to be a huge overhaul that falls apart because it was not something that actually works for your life. Because that yo-yo cycle of dieting or, doing, a big detox or cleanse or something that's very drastic, the yo-yo cycle is actually more harmful than just making those gradual sustainable changes that you can keep up with. So that's a lot of what we're going to be talking about today. And so as you're thinking about your goals for the year, I know that a lot of you probably already started writing down some ideas or probably had some ideas before coming into the session. I wanted to kind of present my approach to when I make a recommendation for a patient, and then also what I think about if I'm thinking about a change that I want to make for myself. And how I kind of work together with patients to come up with these recommendations. So the first thing that you want to think about when you're thinking about a change you want to make for your health is you want to think of the behavior that you're going to be doing, not the outcome that you're hoping for, because you ultimately don't have full control over the outcome, right? There's a lot that we do have control of when it comes to our health, but there's a lot we don't have control of. We know that our environment, our upbringing, our access to resources, our genetics, all of these things impact our health outcomes ultimately. And not always is it something that you have 100% control over, but you do have 100% control over your behaviors, right? And so think about the things that you can control and make your goal to engage in that behavior rather than my goal is for XYZ outcome. Because ultimately, if you don't achieve that outcome, you're going to feel disappointed. You're going to feel upset with yourself for something that's really not your fault. And so you want to make it a behavior that you can control. Then I want to think about what is realistic for you. So for example, for me, I had a baby last January. So for the entire last year, I was not getting very much sleep. So realistically, I'm not going to be getting up early in the morning to go to the gym. That's not a behavior that I realistically can complete. And so thinking about your life and the stresses that you're going through, what are things that are realistic for you to add to your routine that's not going to break your day, or leave you feeling drained, or, in some way interrupt another important vital aspect of your life. And think about the phase of life that you're in, and what is a change I can make that fits in this phase of life. It's maybe not the perfect ideal thing that I want forever, but what can I do now today that's actually going to be possible and going to work for me? And then the last thing is making it something that's meaningful. So you're doing it because it's going to have an outcome that's going to help you ultimately. You're not doing it because someone else is doing it and you're on a challenge together. You're not doing it because you saw it on Instagram and some influencer told you you should do it. You're doing something because you maybe have a specific health condition that you're at risk for. Is a family history that you have. A doctor has told you that you have XYZ condition or you're developing it. And they've given you some ideas of things that might actually be meaningful for affecting that outcome. Because it's important that what you're doing is personalized to you and not just because it's the trend of the day. Because ultimately those trendy things are going to come in and out of favor. It's not something that's going to be sustainable long-term. And you want to make sure that whatever you're choosing to change about your life actually has meaning for you. The next thing I will say is, and this is kind of coming back to what I mentioned before, you want to focus on the change, the behavior, not the ultimate outcome. So what I hear a lot from patients when they're coming in, especially at the beginning of the year, it's the whole new year, new you thing that comes on social media or on ads. Everyone has a goal of a thing they want to achieve this year, and they come in and the goal is very overwhelming. And like I said, the goal is also not ultimately necessarily something you have full control over, but they'll come in and they'll say, I want to lose weight this year, or this year I want to cut back on drinking or quit drinking, or I want to get off all of my medications. And that's a big, overwhelming goal. It doesn't have clear steps to how to achieve that goal. It's just like, this is what I want. So how can you break down that big, overwhelming goal into something that you can actually influence and achieve? And so particularly when it comes to concern over losing weight, Abbie and I both are weight neutral professionals, meaning that we do not focus on weight loss as an ultimate goal. It's much more important to focus on health behaviors that we can control that ultimately will improve our metabolic health regardless of the impact on the scale. And so what is a sustainable change that you could make that might improve your metabolic health? Increasing fiber from fruits and vegetables is a great one, for example. And Abbie is going to get more into this. I'm not going to overstep here into nutrition, but that's kind of the breaking down of that goal that I would recommend looking at. Other common ones that I get are to quit drinking or quit smoking or something like that. That is, again, a big overwhelming goal. What is a step you can take, a behavior that you can do to interrupt that habit that you're trying to get out of, rather than just trying to white knuckle it and will yourself not to do something that's become an ingrained habit. And same with getting off medications. A lot of people have a goal to get off of medications, and in some cases it definitely is possible. It is not always possible in every case. And so this is another situation where you might find yourself feeling disappointed or ashamed of yourself because you didn't get to a specific outcome, but you can control the outcome of like, hey, let's meet, let's check in more regularly with my doctor, see if there's things that can be taken off. Can we tweak some things and see if lowering the dose first makes a difference? And maybe I can gradually work my way potentially off of some of these medications. And again, that's a behavior that you can control versus an outcome that you may or may not be able to fully control. And with that, I'm going to turn it over to Abbie.
Okay, so the importance of flexibility cannot be understated when we're talking about making goals. And I think so many of us are prone to black and white thinking around our health and kind of this all or nothing mentality. So you're either on the wagon or off the wagon. You're completely doing everything that you want to do, or you're just doing nothing. And I think the kind of yo-yo of that, the roller coaster of that, can end up being pretty harmful, maybe even more harmful for your health than just remaining at a steady state. And so really working on, both mentally and behaviorally having more flexibility, having more nuanced thinking around your health behaviors, and recognizing that health is individualized. And so the next step for you in regards to your health may look completely different than the next step for someone else. I work a lot with eating disorders. And so, the advice for someone with an eating disorder to improve their health may be almost seemingly the exact opposite advice for someone else who's trying to, who has different health goals. And so I think just seeing the gray area and being able to see your health as completely individualized and different from others, and knowing that you will never be perfect when it comes to health behaviors. None of us, we're human beings, and our lives fluctuate, circumstances change, and your ability to give energy towards creating new habits will wax and wane depending on what else is going on in your life. And that's not because you're not motivated or you don't care about your health. It's just because you're a human being. And so being kind to yourself, being compassionate to yourself, and kind of trying to view it as a whole rather than what you've done on one day versus another day can be really helpful in maintaining some of these changes. Go ahead. Okay, so Dr. Berens and I have these are actually, I can't credit myself for this. Dr. Berens has 5 pillars of health that she talks about a lot with her patients. And of course, we could talk about many, many different aspects of health, but these are the 5 that we've chosen today just to kind of touch on. And you may have health goals that don't fall in any of these categories, and that's completely fine. But the ones that we're going to be talking about today are nutrition, movement, sleep, avoiding substance misuse, and stress management, social connection. So I'm going to be talking about the first 2, nutrition and movement, and then Dr. Berens will be taking the last 3. All right, so I have one slide to talk about nutrition. So this is going to be incredibly simplified, but I will go ahead and say that it is tough out there right now to, even as a nutrition professional, but especially as someone who hasn't studied nutrition, to understand what's going on with nutrition, to understand what the recommendations are. There's a lot of sensationalized headlines around nutrition recommendations and foods you should eat, foods you shouldn't eat. And I like to tell people that nutrition is really not as complicated as you think it is. For some people, it is. And like I said, health is individualized, but there are general principles of nutrition that pretty much apply to most people, and they're not going to blow your mind. It's not going to be something you've never heard of. But working on improving some of these basic things can go a really long ways in improving your health. So some of the main things that I work on a lot with my clients are eating regularity. So trying to eat something every 3 or 4 hours that you're awake. There are just a lot of people who are skipping meals, are not eating throughout the day, and kind of this chaotic pattern of eating sets your body up to not have a great relationship with food. And so that's really the best place to start. I usually tell people, even if you aren't able to think about what kind of food you're eating every 3 or 4 hours, just eating something every 3 or 4 hours that you're awake will really help you to regulate a lot of things going on with your body. And that kind of goes along with the second one, which is body cue awareness. So I practice something with my clients called intuitive eating, which is basically a philosophy that helps people to reconnect to their body cues around food, specifically hunger, fullness, cravings, things like that. Because a lot of us have lost touch with those cues through, whether it's through dieting or stress or trauma, or there can be all kinds of reasons why we're not able to hear the cues that our body gives us. But our body is very intelligent when it comes to being able to regulate how much food we need to eat and the types of food we need to eat. It's just that a lot of us are kind of caught up in our heads and not very in touch with the body cues that we're getting. And so trying to reestablish a connection with the signals your body is giving you about when you're hungry, when you're full, which types of foods make you feel the best, and not just taste the best, which is totally fine to eat foods just because they taste good, but also which foods make you feel the best energy, have better digestion, better sleep, things like that. And again, this will be different for everyone. Everyone's bodies prefers different kind of different nutrition approach. And so there are lots of different ways to do this, but just very broadly speaking, your body has a lot more wisdom to offer you than I could just generically give you advice right now. But there are a few things that if you are trying to improve your health and again, I'm just saying over and over that this is very generalized, so this may not be true for everyone. But I like to focus on including more nutrient dense foods rather than excluding anything. Contrary to what you may hear in the news or on social media, there's no foods that are like toxic or poisonous or just killing you. It's just the absence of nutrients and fiber, vitamins, things like that can be detrimental to your health. And so rather than trying to cut any foods out, trying to focus on including more nutrient dense foods, which will be more plant-based foods, fruits and vegetables, foods that have a little bit less processing. If you're able to cook at home, all those things can help. And of course, this may depend on your, accessibility and your time and all of that. And so please don't put more pressure on yourself than you can handle at this moment to make any changes. But the inclusion versus exclusion, I think, goes a really long ways in making these changes sustainable, and also just doing it in a way that feels good to you. Eat the foods that taste good to you. You don't have to force yourself to eat tons of foods that you hate, because again, that's not going to be sustainable. So these are just kind of, grazing the surface of, we could have a very long conversation about nutrition, but I think just keeping it simple as best you can and focusing on one change at a time, and also really focusing on the way that it's making your body feel. Any improvements in energy, mood, sleep, things like that are more likely to motivate you to keep on doing this rather than just, going on a crash diet. Okay, and then movement. So again, it just depends on where you are in your health, whether a step towards movement would be the right step for you. But some things I talk about with people who are interested in incorporating more movement into their lives is actually first focusing on reducing long periods of sitting. So there's actually been some interesting research that even for people who exercise regularly, their health, if you're sitting for long periods of time without getting up, standing, you're just sedentary for hours on end, you can still have detriment to your health, even if at the end of the day or at the beginning of the day you're doing some kind of workout. And so it sounds like a small thing, but it is a hard thing because we all sit so much and work at desks and computers and things like that. And so trying to find ways to just incorporate standing up a little more often, taking breaks, even if it's just to get up and go to the bathroom. You don't have to be getting up out of your chair and doing jumping jacks or something like that. Just getting up, walking around, walking to the mailbox, drinking some water, whatever it takes. That can be a really great, and you may not notice a huge difference in the way that you feel when you do that, but it is really beneficial for your health. And secondly, focusing on enjoyable movement. So there are a lot of different ways to move. And I use the word move instead of exercise because I think exercise can be a very rigid, like must be in the gym or must be sweating, must be X amount of time or calories or something like that. And really any kind of movement that you can incorporate, any movement of your body is beneficial to your health. So focus on things that you like. You don't have to, if you don't like to run, you don't have to run. You don't have to run in order to have better health. If you like to do yoga, if you like to walk in the park, if you like to just clean your house or do gardening or, playing a sport can be a really great way to also get some socialization, which we all need these days. So there are lots of ways to move. And so really getting creative with it and trying not to put rules around, like I said, the length of time or how hard you need to be working for it to count. These are all just made up rules that are not real. Any movement is good movement. And so focus on doing something that you like and that you will maybe look forward to, or at least that you can tolerate. If you hate doing it, if it hurts your body, it's not going to be sustainable long term. And that's really what this is all about, is making changes that you can sustain. And so, focus on doing things that you truly like and enjoy. And then lastly, I said this on the nutrition portion, but I want to bring it up again, listening to your body cues. there's so many people who start a new exercise regimen and then get injured and then they just quit and they're done with it, you know? And so I really think the kind of no pain, no gain mentality has been a bad thing for people who try to move and exercise as a whole, because it kind of teaches you that if it's hurting, that's good. And you know, there's a difference between pain and exertion. And so really getting to know what it feels like in your body to maybe push yourself, but not to the point where you're going to get injured or where you can't recover properly or where it's no longer enjoyable. And these are all things that you just have to determine inside of your own body what it feels like. Nobody can tell you what the right or wrong form of movement is for your body. But especially as we age, you know, doing types of movement that are joint friendly and you know, that are going to be protective of your body overall is important. And so just listening to what your body's telling you around that and not pushing it. And it really is finding that balance between, like I said, pushing yourself, but not too far. And only you can determine what that is. And now we'll turn it back over to Dr. Berens.
All right. So the next pillar that I want to talk about is sleep. And this is like so my soapbox that I am on all the time with patients. I think that in our culture specifically, you know, the Western culture, but particularly in the US, sleep is very much not respected as necessary. I think we have this very grind culture, you know, hustle culture. Sleep is for the weak. You know, you hear these sorts of things all the time. And the reality is that sleep is absolutely vital for sustaining your life. It is not optional. And you need to have adequate, good quality, restful sleep for your body to be able to function properly. And there are so many medical problems that are affected by your like sleep deprivation or poor sleep quality or both, particularly the metabolic health conditions that I think most people are very concerned about. So, you know, the biggest killers, the ones that we're always hearing about in the news, cardiovascular disease, diabetes. These things are directly impacted by sleep quantity and quality. And so what I find myself talking a lot about with patients before we even talk about anything to do with nutrition or movement is sleep, because I think that is the foundation and that gives you the energy to be able to do the other changes during your day-to-day. So the big things that I would focus on with your sleep, first of all, like your routine. We are routine-driven animals. We have circadian rhythms that are built into our biology. We are supposed to get up in the morning and go to bed at night. That is how we are built. A lot of people, unfortunately, work shifts. They have different work schedules. They're working late nights. They're working early mornings. They're shifting back and forth between. So anything you can do to improve the routine quality of your sleep is going to improve your sleep quantity and quality, because it will help it make it easier for you to fall asleep and stay asleep when you're on a continuous routine. And there definitely are people who are in work situations or have babies, like I said, that cannot follow this routine, and you definitely feel it in your health. And so that's something that we can work on an individualized basis to try to find a better balance for you if you're in a situation like that. But that's sort of the first thing. And that comment there about sleep hygiene, that refers to the routine that you get yourself into in order to be able to fall asleep. And it refers to removing barriers that make it more difficult to fall asleep. So for example, light from your phone or from the TV or from any other screen, or if you work shifts and you get up out of your shift and it's bright light in the morning, our circadian rhythm is stimulated by light. So light tells your brain it's morning. If you're stimulated by light, it's very difficult to fall asleep. And so having a relaxing bedtime routine that primes your body for sleep and does not stimulate with light that would stimulate your circadian rhythm to be awake is very, very important. So that's an important piece to look at. The next two, quantity and quality. So quantity refers to number of hours of sleep, and not just number of total hours, but also the continuity of those hours. So if you're sleeping 10 hours a day, but it's in 30-minute chunks, that's very different than sleeping 8 hours continuously. And so, you know, there are a lot of conditions that disrupt our sleep that cause us to wake up in the middle of the night and can affect our sleep quality and quantity. And so addressing those conditions can be really helpful to improve the overall quantity and quality of sleep. And then when I refer to quality, what I mean is, are you having normal sleep cycles? So you're going through the normal, you know, sort of deep sleep, NREM, which you may have heard of, like rapid eye motion. REM sleep is when you dream, versus NREM is when you're in more deep sleep. And that cycling has to happen in a certain way. And if it's not happening in that way, if the quality is not good because of sleep disruption or because of a sleep disorder, that can affect the overall quality of your sleep and the restfulness of your sleep. So these are all things that I look at with patients. And like I said, I always start with talking about sleep because I think it's the foundation of a lot of our other habits. If sleep is not under control, it's going to be very difficult to make changes in other areas of your life because you're just not, your body does not have the period of rest that you need to be able to then do exertional or more complicated changes during the day. The next one I'm going to talk about here is substance use. And I think when people hear substance use, they immediately hear judgment and they think of hard drugs. And they're thinking that I'm talking about them being a drug addict or something like that. When I talk about substances, I'm talking about any non-food substance that you're putting in your body. Every substance is biologically active in some way. The substances that we typically think of, things like caffeine, alcohol, recreational drugs, tobacco, vape products, all of these things have health effects. And like anything else, the dose makes the poison. So there are some people who love their morning cup of coffee. They have one cup of coffee a day. They're happy with that. They enjoy the process of drinking their coffee. They enjoy the taste. They enjoy how they feel. That is very different than someone who's drinking energy drinks starting from 8 p.m. till midnight to stay up and cram for exams every week, like some people are having to do in college or who are taking night school. So there's varying levels of substance use and intake, and the amount of effect that it has on your health is very different depending on the type of substance and the amount of the substance. And so when it comes to substance use, again, it's nothing about judgment. It's nothing about, you are good or bad or should and shouldn't be using any given substance. The way that I always approach it is, what is it adding to your life and what is it taking from you? Because like I said, all of these substances in some form will have some health effect that is overall not detrimental. It's overall detrimental to your health in some way. And it is the dose makes the poison. And so you have to determine for yourself, is this adding more to my life than it's taking from me? Is it potentially contributing to a health problem that I'm concerned about or that I'm struggling to manage? And then how can we come up with a way to either reduce, or do I need to actually fully remove this substance from my life? And that varies very much depending on what's going on with your health. But I think it's an important thing to bring up. And like I said, I think that it's often not discussed because there is so much fear of judgment. Or fear of being shamed or guilted or feeling shame or guilt around the use of substances. And so that's something that I really try to work with patients directly to kind of help them determine if there is a substance that they're using, is it benefiting them in some way? How might it be harming them? And is there a way that we can either reduce or remove it and replace it with something that would be more beneficial if it's filling a need for them that could be fulfilled in a more healthy way. And so it's an important thing to address. And like I said, I think frequently overlooked, particularly caffeine. I think a lot of people, the use of caffeine is so normalized in our society that it's often not thought of as a substance, but reality, it is a substance. It's very biologically active and it does have detrimental health effects. And then of course, alcohol is definitely in the news right now. The Surgeon General has just come out wanting to put warning labels on alcohol because of the cancer risk associated with it, which is very true. There are several other health problems associated with alcohol use again. And again, it's very normalized in our society, but it is something that is important to discuss and think about, particularly in the setting of certain health problems that might be worsened by the use of alcohol. And so that's just something that I think is important to bring up. Certainly there are some substances that are easier to reduce or stop using than others. Some are more addictive than others. And sometimes you actually do require some support, whether that's therapeutic support from a therapist or a counselor, or even medical support to be able to safely reduce your use of certain substances. So something I definitely encourage people, if it's something you are struggling with, or you're thinking like, this might be the year that I want to change my relationship with this substance, definitely want to reach out to your doctor to talk about how to safely do that and how to get the support that you need to do that. And then the last pillar here that I'm going to talk about, which again I think is also it's more discussed now, but still something that I think is overlooked, is the importance of stress management, and not just stress management, but social connection in our health. We are social animals. We require social connection. When we do not have social connection, it is directly harmful to your health. And we see that in studies that show the effect of loneliness on worsening health outcomes for various health conditions. People who live alone, don't have support of others, even with similar markers otherwise, when it comes to their health conditions, tend to do worse. And so it is important to have a way of managing the stresses of modern life, which is not biologically how we were designed to live, and the stresses of the increasing amount of social isolation that we see now. And social media is a double-edged sword. There are some ways in which social media can increase our connection, because it can allow us to stay in contact with people who are maybe not physically next to us. But as we have all seen, especially in the last 5 years, it can also create increasing division and separation and anger between people that is really creating a lot of disconnection and isolation. So I think it's very important to address that from a health standpoint, because it does have a direct effect on your health. And social media use, we do see even some almost similar to substance use effects on people's health, and difficulty in reducing substance use, almost to the same degree as coming off of certain substances. It can be very difficult. And so I think the management of our stress, whether that's, if you're religious, you're seeking religious support. If you are, if you have a strong family, staying connected with that family. If you don't have those supports in your life, finding your people, finding the people that are supportive to you, the people that you can connect with, the people that understand where you are in your life, that you can trust and go to for support. Maybe you need some support from a therapist or a psychiatrist if you're really struggling with a lot of effects of stress. If you're having symptoms of conditions like depression or anxiety, getting that support, because that's really important. It's going to be really difficult to make any other substantial changes in your life when your level of stress is so high. And stress has a huge impact, again, on those metabolic conditions that we're most concerned about, and cardiovascular disease as well. And then when it comes to social connection, I think talked about social media, the double-edged sword that is, curating the amount of and type of social media that you're consuming, and trying to avoid or remove yourself from areas of social media that are maybe creating more harm than benefit in your life. And so I think that's an important thing to address. And I think, again, something that's not often discussed in the exam room with the doctor, but I think is very important and should be addressed and brought up. So from there, I want to make sure we have a chance for everyone to kind of ask us any questions that you have. If there was anything that we talked about today that sort of gave you any ideas or any thoughts about tweaking or changing any of the goals that you had. So I want to open it up now. You'll see a little hand sign.
I was just gonna add to that. I think like something I talk a lot with my clients about is the fact that we know a lot of these things that we not should be doing, but could be doing to improve our health. It's not for lack of information. And so really understanding what are the things that are keeping you from being able to do this. And it's not because you're a bad person, because you're lazy, because you don't care. There are usually real reasons and barriers preventing you from making these changes. And so self-compassion is so key in understanding, our brains are trying to keep us alive in many different ways. And some are more functional than others, but some are just patterns that we learned from the time we were young for how to take care of ourselves. And even though logically we want to change those, we have to kind of understand more why these things are hard. And even though they sound simple, there can be really very real barriers to implementing them. And so I think just staying kind to yourself in the process, and recognizing that even if you know this information, it can still be really helpful to meet with a doctor, a dietitian, a therapist to process individually why these things are challenging for you and what steps you can take.
Yeah, I think that's a really good point, because I do hear that a lot. Sometimes it's like, I think patients almost feel they don't deserve to have the support because they're like, I already know this. I should just be doing it. But it's really not that simple. And investing in yourself, having that support can be huge. And I think it's sometimes it's an overwhelm. It's like, I know all these things that I could, should, would have been in the past doing, all these barriers in place. I don't even know where to start. And even just trying to prioritize which thing is most important to my health at this point. Can we start there? Can we get that habit, kind of good and ingrained, and now it's second nature? You don't have to think about it. Okay, now let's move on to the next thing. And where do we start and how do we build on that? Because I think especially this time of year, everything you see is like, overhaul your life, do all these things at the same time. And yeah, I mean, that'll work for a couple weeks. You'll probably manage to white knuckle your way through it, but then you'll come out of it completely depleted, feeling even more lost and overwhelmed than you did before. And like you said, Abbie, you might actually be worse off for it because your body has just cycled up and down through that yo-yo. That can be really hard on your body to make those big drastic changes back and forth. So I think having the support and the accountability and the coaching through making those more gradual changes can be huge. Any other thoughts or questions or anything? Oh, thanks, Angie. Appreciate it. Great. Well, if there are no other questions or anything, y'all are welcome to log off. And I will be sending out, actually, let me share here on the screen, the list of resources that Abbie and I put together for the various pillars, things that could be helpful if there's something in one of these areas that you are wanting to focus on for the year. These are all, resources that we have personally vetted and trust and provide good information. And can be useful. I particularly want to call out for sleep. There is a CBTI, which is a type of cognitive behavioral therapy for insomnia specifically, that is really, really helpful. And a lot of these resources that we include here have good evidence base behind them, and are really helpful. So I wanted to just share all that with you in our the email that I'll send out after this talk, and I'll also put the recording if there's anything you want to go back and review again.